Diabetes is a condition where the body doesn't produce enough insulin or where the insulin doesn't work properly. Around 3 million people in the UK have diabetes. The majority of our children have type 1 diabetes. In the UK, about 20,000 children have type 1 diabetes, and around 10% of all adults with diabetes are type 1. In our area, we have about 250 children with diabetes across the 2 hospitals. They are looked after by the Children's Diabetes team, which consists of 2 consultants, 4 paediatric diabetes nurses, 3 specialist dietitians and our team coordinator. We're able to give support to families in hospital, at home and at school.
Hi, my name is Ben and I'm 9 years old. I had diabetes when I was 2 and I've had it for 7 years.
So what's it like having diabetes?
It's good because it doesn't stop you doing anything, and it's bad because when you're playing like sports and you have to rest, you have to stop, and when you're low and you're just getting a big meal and you don't really want to eat anything, or you have to eat more stuff to get you back up, not being low.
Okay, but can you still eat whatever you want?
Yeah.
What's your favourite food?
Chocolate fudge cake.
So how do you treat your diabetes?
I roughly test 8 times a day, and I have a pump that gives me my insulin that I would normally inject.
So you don't have to use injections anymore?
No.
So what's it like coming into hospital?
It's quite cool because you will get your overall number from your 3 months, and you get to do lots of testing.
My name is Cheryl, I'm Ben's mum, and I've also got another son, Josh. Both boys have type 1 diabetes, and so we've been living with diabetes in our family for 7 years.
So can you just tell us a bit about what it was like when they both got diagnosed and you first came onto the ward?
Well, Ben was 2 when he was diagnosed, and it was quite a shock because he hadn't been particularly poorly, unlike a lot of children when they come into the ward. But the whole thing is information, really. I wanted to know everything that I could as soon as possible, and obviously not everybody could give me that information straight away. But as soon as the paediatric diabetes specialist nurse came onto the ward, then obviously that was more reassuring because she was able to give me more sort of specific knowledge.
So do you think there's anything the nurses could do for other families to make it a more smooth experience, or to reassure you?
Yeah, I think the reassurance thing that it's not a life sentence, the fact that your children, can have, and that was the thing, that being on the ward at the time, there were some very sick kids there that day, and as we walked down the corridor, you think it's knowing that yes, this is a horrible disease, it's a chronic lifelong disease, and it's a silent disability, but there are a hell of a lot worse things in the world for your children to have. It's eminently manageable and it doesn't stop them doing anything. And if anything, my kids are proof that probably they do more stuff because of their diabetes, because we're so determined that they won't miss out on anything and it won't stop them doing anything.
It's really important when testing a child's blood sugar that they wash and dry their hands thoroughly. Otherwise there could be residual sugar left on their fingers, which can give a falsely high reading, and if their hands are not dried properly, this can give a falsely low reading. The children must only use soap and water to wash their hands and not use alcohol gel or baby wipes, as these can also provide false readings.
Hello, I'm Harris and I have type 1 diabetes, and I'm going to show you how to do a BG test.
All children that are newly diagnosed with diabetes will start on this machine, the Aviva Accucheck Nano. To set up the machine, there will be a black chip that comes in the box. If you insert the chip into the side of the machine, and this gets it ready. With the finger pricker, it will come without any needles in it to start with, so you need to insert those. That just inserts there, and then you put the lid back on. The numbers that are shown across the bottom, that's the needle depth. So we would normally start the children on about a number 2, but if you're finding that you're not getting enough blood, you can turn it up to a number 3, and then vice versa. If you're getting too much, you can turn it down again. The number that's shown here is the number of needles in the barrel. So after you've used each needle, you need to turn it onto the next needle, and you do that by moving the white thing across and back again, and then it will count down until you've used all the needles, and then you just literally take it out and replace it with a new one. Once you have placed the finger pricker on the finger, you just press the end in to fire the needle. Basically, the children can use all the sides of their fingers, so we advise them to put their hands together like this and prick only the bits that they can see. We get them to try and avoid their thumb and their forefinger, as over long periods of time they can lose their sensitivity. Strip is inserted into the machine at the bottom, and you just need to make sure the code on the machine is the same as the code on the box of test strips. So once you've got the blood from the child, get them to place it on the end of the strip and it will get sucked up. You can go backwards and forwards through the blood sugars on the machine using the arrows, and please write all these blood sugars down in the folder. Blood sugars should be tested before every meal and 2 hours after. Okay, just to recap, when testing your child's blood sugar, make sure they've washed and dried their hands thoroughly, always use a new needle, avoid the thumb and the forefinger when testing the blood sugar, always test before meals and 2 hours after, and document your findings.
My name is Maxine Libby and I'm a paediatric diabetes specialist nurse. I'm going to talk to you today about injecting insulin. So now we're going to show you how to do an injection. So we take the lid off the pen, unscrew the middle and insert the pen fill of insulin. Connect the pen back together and attach a needle. Remove the white cap and then remove the green cap. It's important to remember not to resheath the needle after the injection with the green cap to prevent needle stick injuries. Dial up a 2 units of insulin and do an air shot to ensure the insulin fills the needle before injecting. If this is not done, then the child will not receive their full dose of insulin. The child will then dial up their dose of insulin by pulling out the end of the pen, 3 units. Each turn of the pen is half a unit. Once they have dialed up the dose, insert the needle at a 90-degree angle into their chosen site and push down the top of the pen, and then count to 10 to ensure all the insulin is injected. The child will then remove the needle, replace the white cap over the top of the needle and unscrew the needle. Each needle is for single use only, and then the used needle should be disposed in the sharps bin. The areas the children can administer their insulin is into their arms, their tummy, this area of their thighs, and their bottom should be this area. It is important that the children rotate their injection sites so that the sites do not become lumpy, as the insulin will not be absorbed as effectively. Sometimes a child might bleed after an injection, but this is nothing to worry about. It means that they have hit a little capillary and it will have no adverse effect.
The diet for diabetes is not a special diet, it's a healthy diet. There are no foods to avoid completely, but there are some better choices than others. This brief will give you an insight into hopefully how to make the right choices, and also to begin carbohydrate counting. The key points for somebody newly diagnosed with diabetes are to eat regularly, to include some sort of starchy carbohydrate every time you eat, to eat a wide variety of foods, and to follow general healthy eating guidelines. I'm sure you will have seen this plate before, and it's this that guides us with making healthy eating choices. And when you eat the foods in the proportions shown on the plate, it gives you a good balance of foods. In diabetes, however, carbohydrate is most important. Carbohydrate is found in starchy foods like potatoes, rice and pasta, milk and yogurts, fruit and some vegetables, and in sugary foods like sweets and cakes and biscuits. When food is digested, the carbohydrates in the food are broken down into glucose, and it's this glucose that gets into the bloodstream. It's then the job of insulin to move that glucose into the cells of the body. Obviously, the more carbohydrate that somebody eats, the more insulin they would need, and it's important to match accurately the amount of insulin with the carbohydrate that each person has. On the ward, the sources of carbohydrate would include, perhaps at breakfast time, breads, cereals, milk and fruit, and at lunchtime, potatoes, rice, pasta, pastry, and some of the puddings. And then in the evening, things like sandwiches and yogurts and fruit. Of course, any snacks between meals also have to be counted. Things like fruit or packets of crisps and other snacks that can be bought elsewhere in the hospital. So it's not just important to identify the sources of carbohydrate in the diet, but we teach the patients and the families how to accurately assess the amount of carbohydrate that's there, and that's carbohydrate counting. So when somebody is newly diagnosed with diabetes, the dietitian will assess initially their diet that they're currently on, and from that we will do an initial assessment of the amount of carbohydrate that they have, and they'll start off doing basically what they've always done, with maybe a few modifications to cut out particularly sugary things or things that are really not going to fit in with the insulin regime that they're on. But once that's done, then we spend time with each patient and carer teaching them how to carbohydrate count. Information about the carbohydrate content of all the hospital food can be found in the diabetes folder on the ward, or if you have any other queries, please ask one of the diabetes dietitians.